Good afternoon, everyone. Again, this is a wonderful day to be learning about health, Black health, and to have a sense of community. My name is Rosalind Young Daniels, and I'm here to introduce the next panel. The Black Church is considered to be among the most trusted institutions in the Black community, and the National Black Clergy Health Leadership Council brings together Black clergy leaders across the nation to advocate on behalf of their respective communities. This initiative has born the Choose Healthy Life organization. Let's meet the founder and its executive members. Debra Frazer-Howze. Debra Frazer-Howze is the founder and president of Choose Healthy Life. She has been widely recognized for more than 3 decades of global leadership to communities of color regarding a myriad of concerns that impact the Black community, including teen pregnancy, social welfare, HIV and AIDS. She advised 2 U.S. presidents while serving on the Presidential Advisory Council on HIV/AIDS from 1995 to 2001. Now I'd like to introduce you to Rev Jacques De Graff, who has quite a bio. Rev Jacques De Graff has served on the pastoral staff at historic Canaan Baptist Church, where he was ordained under Reverend Wyatt T. Walker, who was Reverend Martin Luther King Jr.'s former chief of staff. He has become renowned as a champion for health equity, and inclusion. He is currently the president of Friends of Harlem Hospital and chair of the MBE Summit for businesses looking for economic and social justice. Reverend David Jefferson is the pastor of Metropolitan Baptist Church in Newark, New Jersey. He is a graduate of Grambling State University and earned an MBA, yes, an MBA in marketing and finance from the University of Dayton, Ohio. He is also has received a Juris Doctorate of Law from Capital University in Columbus. Lastly, Reverend Horace Sheffield. Reverend Horace Sheffield III was born in Detroit, Michigan, has many connections to the civil rights and labor movements, including his father, Horace L. Jr., A. Philip Randolph, and Dr. Martin Luther King. First licensed to preach in October 1978, he is currently the pastor of Detroit's New Destiny Christian Fellowship. Thank you, you all, and please take it away.
Thank you, Rosalind. And thank you so much for having us. And I am so happy and pleased to be here with these 3 giants, 3 giants that I have on the Leadership Council for Choose Healthy Life. Choose Healthy Life is also co-chaired by the Reverends Al Sharpton and the Reverend Dr. Calvin Obust III, both of whom send their blessings to all of you in the audience today. She's already introduced 3 of the members of the council. There are 2 others. There's Reverend Frank Tucker from Washington, D.C., and Reverend Dr. Raphael Warnock, as many of you know, as Senator Warnock from Atlanta, Georgia. So I'm just going to give you a little bit of background on how Choose Healthy Life got started. I think Rosalind says in my introduction, I'm the founder of the National Black Leadership Commission on AIDS, which I founded in 1987. It is still the oldest, largest policy agency for HIV/AIDS in the Black community, now called the National Black Leadership Commission on Health. After leaving BLACA, after many years and establishing affiliates all over the country, along with Reverend Calvin Butt, who supported me in my work back then, I went on to private industry. And in private industry at Orashore Technologies, I was Senior Vice President of Government and External Affairs. And in that role, brought forth the AIDS test, the Ebola test, the hepatitis C test, and all of the other tests to market. I'm still working with them now. We just brought forth a new COVID test. And I learned something from the union of those two experiences. So when I retired again, I was sitting at home watching them actually take my people and put them in black body bags and throw them in the back of refrigerated trucks in New York, at a New York City hospital. I knew that I couldn't sit back and watch that anymore. So I had to get up and do something. I used a little bit about what I learned at BLACA and a lot of what I learned on AIDS, a lot of what I understood about community organizing, and went to another diagnostic company because that was my corporate background, and received $5 million from Quest Diagnostics to start Choose Healthy Life. The focus of Choose Healthy Life is to fund the Black church. One of the things that we firmly believe in is that if you ask the Black church to do something, a lot of people ask them to do things for nothing. And that is absolutely antithetical to what it is you need to do if you want something to last and sustain itself. So we went out and got this money to fund 50 Black churches in 5 cities. And those 50 Black churches in those 5 cities each hired public health navigators, and their job is to go out in the community, help with testing, help with vaccinations. And as we move on with this, it'll be to help with other health disparities in the community. We need a public health workforce on the ground in the church. I've been blessed, and that God has surrounded me with some of the most powerful men in the clergy. And it is their power and it's their impetus that keeps me going. So they like to credit me, but it's them and their strength, because I feel so safe in fighting for the community with them, you know, the wings beneath our wings. I can't imagine another group of men coming together to do such a wonderful thing. We are getting ready to add women to the council. So the men have decided that there have to be some women added to the council, so that we are going to be, we're recruiting some women pastors, female pastors now to be a part of specifically the advocacy that goes on. When we could not get vaccines in our community, these men picked up the phone and called the governors and the mayors, and the vaccines appeared in our community. When we could not get testing in our community, these men picked up the phone and the testing appeared. There is no greater tribute that I can give to them than the fact that they are actually saving the lives of everybody that they touch. The first 5 cities were New York, Detroit, Washington, D.C., Newark, and Atlanta, Georgia. We are now gotten a grant from HRSA, and this is my final comment, and this is all part of God's blessing because of them. We've gotten a grant, a $9.8 million grant from HRSA, and another million just a few weeks ago, to expand from 5 cities and 50 churches to 120 churches in 13 states. So we are fairly busy, but we're going to get this done, and we're going to get it done for the community, and without them, that could not happen. I have a question. My first question is for Reverend Sheffield. Reverend Sheffield, when I came to Detroit to visit you when you were doing your vaccination program in Detroit, we had hundreds of people that were coming into the church. 400 people came into the church to get vaccinated. You were there and somebody showed up, the mayor of Detroit. He had opened up the stadium in Detroit, and only 50 people showed up at his church. Can you tell us a little bit about that experience and what happened and what you did to make that a possibility?
Well, first of all, let me commend your effort. I often tell people when they ask me about Debra Frazer-Howze that she's able to transform a pile of bricks into a cathedral. She's a consummate organizer and has had a great impact on me because, as you know, Deborah, I was really enmeshed in civil rights as my father was. Helped to found the National Action Network, had the first chapter outside of New York. But somewhere along the line, I realized that fighting for people to be treated better is secondary to making certain that they live better. And I owe that to you because having good health, being able to sustain one's life certainly empowers you to fight to be treated better because you value your own existence. Yeah, what happened in Detroit is really unique, and I don't like you take credit for things, but we had a testing protocol here that basically prohibited the significant numbers of African Americans and poor people in this city. They placed the one testing site on the border of Detroit, the suburban border of Oakland and Wayne County. You had to have a primary care physician. You had to have a script. There were all kinds of other protocols that were in place. And through Choose Healthy Life, Deborah, our first day, which I was able to work through DMC, I want to give credit to them. I think you remember Sinai Grace, who facilitated us being able to do the testing without protocols. We had 1,500 people show up. Grand River, one of the major thoroughfares in Detroit, had to be closed. And that told me that people wanted to know their status. So the reason I think we've been successful, number one, is that we do stuff for people all the time. As you well know, I mean, we feed people, we clothe people, we house people. This whole notion of trusted servants, of people being able to go somewhere where they feel comfortable, all of that is certainly at play in this. And so because we were the first ones that consistently offered testing, we partnered with World Central Kitchen, if you remember, distributed over 200,000 meals, breakfast, lunch, and dinner every single day. When we transitioned into vaccinations, even though the city of Detroit used it used to be called Coble Hall, some corporate entity, TFC set it out. And the mayor said out of his own mouth at the press conference that he just left there, they had 50 people, we had 450 in line. And that's because I think we've built a relationship. The churches that are part of the initial funding process have all worked together. No one's competing with each other. We share information, we share resources. And I think people trust us that number one, we can communicate with them. We don't run roughshod over people's sentiments, even as it relates to vaccinations. We try to have some value added conversations about that. So Choose Healthy Life enabled us at the Sheffield Center and at New Destiny to be able to reach people. We were doing probably through all the services through Choose Healthy Life since around February, March, servicing over 5,000 people per month.
Yes. And you've been doing a wonderful job. And I'd just like to add that Reverend Sheffield has his own clinic on site. And Reverend Jefferson, let me just talk to you. One of the things that you have been pushing me to understand is that we must sustain this project, that the project can't go away when COVID goes away. And I often say, because of you, I often tell people, I met with the head of the CDC just Friday, and I told her that we can't go back to normal because we died in normal. So we refuse to go. Never again will we allow this to happen to us. And it's been you and your fight and your push for me. Tell us a little bit about the importance of sustainability of these kinds of programs and what's going on in Newark.
Let me first of all, like Reverend Sheffield, Deborah, we cannot do this enough. I know that you sometimes embarrassed by it, but you are beyond a doubt a visionary and a person who can see into what something can become. And so we want to give you a lot of credit. One of the things we do not do is lift up people who stand for people to better other people. And so we need to at least make sure that everybody know that you are the visionary. We have experienced a moment in our nation, one of the darkest moments ever, where we have lost already 700,000 lives to this pandemic. Before the end of the year, 1 million people will almost die as a result of this pandemic. This is one of the darkest moments in the history of our nation, and these numbers are staggering, and people need to pause for station identification, not gloss over those numbers, but recognize a disproportionate number of those individuals are people of color who look like us. And as a result of that, I firmly do believe that it is very important for us to take this moment and transform it into a movement. A movement would represent sustainability. A movement would represent legacy. We have suffered in many instances in our community from start and stop kinds of initiatives. We must now use this as leverage to tell America, stop treating us like people of crisis, and let's fold in a plan that will address the ongoing health needs of our people. When we first started testing, doing vaccines, we found over 100+ people in 2 days who had high blood pressure. We were able to get those folks to the hospital and avoid a stroke. I have 2 brothers right now who have strokes because they did not keep their blood pressure in check. And that is because we do not have a sustainable program through the Black church. We have people coming to the Black church. We have now in Newark created partnerships. We have 5 partnerships. And those partnerships are really created with FQHCs. FQHCs have been a huge help to us. Those are strategic, collaborative partnerships that allows us to expand the resources that we have in the church. And by the grace of God, the funding that we're getting through Choose Healthy Life, when you combine that together, it's absolutely critical, it's absolutely important. And so at the end of the day, with the bill moving through Congress, and I just sent something to my friend, our senator, member of my church, Cory Booker, to say to him that we have to be on the front line in order to ensure the fact that this is not just a moment, this is not just an initiative, but we absolutely need sustainability. For 25 years, by occupation, I was with AT&T as a top executive. And one of the things that I found that represented the power of that company was the fact that they had a network. They had stations all over the United States and around the world. When I ran international, I traveled and found out that we had all of these connection points for which we could get communications around the world. Guess what? The Black church is one of the few institutions in this nation that has a network that is grounded in the Black community with a trust factor and credibility to get things done. And I think for the resources that Choose Healthy Life has invested, for the workforce that Choose Healthy Life has put in place, we would be remiss if we did not optimize that infrastructure and optimize that workforce in order to ensure that we have longevity and sustainability. I will say this, and all the folks who are listening, you can count on me doing everything I can with Debra and these brothers of mine and sisters to ensure the fact that Choose Healthy Life does not end the end of this year and going into next year. We need 22, 23, 24, and 25. And so we speak of things as though they already exist. I don't intend to preach, but I got to tell you, it's hard for a preacher to have a few moments and not preach. But Debra, I'll turn it back over.
Thank you so much, Reverend. And Reverend De Graff, you have been, a partner with me and gone with me to meetings at Quest Diagnostics, and where we talk about, what the next steps are and looking at the other diseases, as Reverend Jefferson has said. Tell us a little bit about your view or your vision of these disproportionate diseases, how they're impacting our community, and where we should be going with some of this.
Well, first, let me add my voice to the chorus to say this. Europeans have Joan of Arc. We have Debra Frazer-Howze. And her leadership is what brought us together, but it's tried and tested leadership. Some people consider leadership by standing in front. Debra has created a record of achievement. And so the National Black Leadership Commission on AIDS put itself out of business. Did you hear me? There's a cancer society, there are 100 disease societies, but none of them have put themselves out of business like the National Black Leadership Commission on AIDS. And how did we do it? We did it by creating an agenda that had an expected outcome. And so this moment in time, when we talk about advocacy, when we talk about outcomes, one of the things that we have to talk about is authentic leadership, not out front, standing in front of the press opportunity leadership, but authentic leadership. So in our communities in New York, I got my booster shot yesterday. Our national co-chair, Al Sharpton will be getting his at Harlem Hospital this week, because you can't lead where you didn't go. And so the leaders who have been chosen are effective in each of their cities. Brother Sheffield, Brother Jefferson, this is not their first rodeo. They've been in the fight a mighty long time. So when they call the community to arms, people respond. In New York City, what we've done is we've reached across denominational boundaries. We've reached across geographical boundaries and put together a coalition that is prepared not only to address what Brother Jefferson talked about in terms of sustainability, because one of the hallmarks of this movement is that we don't have to go around with a tin cup while we're waging the fight. You've already done that. And so we have resources, we have enthusiasm, we have motivation, and we have discipline as we move forward. Our community is besieged by health disparities. One of the things that each of these preachers is experiencing is in their own congregations. They've lost pillars. We've lost pillars, people who we were emotionally and spiritually connected to. And so the fight, we're invested in this fight. We're invested in this outcome, but it also provides us with a platform of authenticity to advocate for the future. This isn't going to end on date certain. It's going to end when we say it ends. And it is empowering the church, because there are churches right now under siege. Some churches are shuttered. Other churches are live streamed, or you got to make a reservation to go to your church, and they're capped at attendance. And so our communities are hurting and looking to us for leadership. In the introduction, we were told, it was said that the Black church is one of the most trusted institutions. Excuse me, it is the most trusted institution. Put our record against any other institution in our community, and you'll see what I'm saying. We're the ones who did not only civil rights, not only AIDS, not only teen pregnancy, but we went overseas and fought apartheid in South Africa. And that record of success allows us to go to a Quest or to the White House and say, if you walk with us, you'll get results. In New York City, when we started out, we were trending at 32%. We're now at 55% in Black New Yorkers. And so this is a moment in time when a variety of things, forces, and factors have come together. And the key to all of this is not to talk about what we don't have, but it's to talk about what do we have in our hands. And when we put our hands together, we can conquer this, and we can go on to conquer all the disparities that plague our community.
What's in your hands sounds like a sermon that I'm a little familiar with, Abyssinian Baptist Church. I love it. And gentlemen, you know, there's a new study that just came out, and it says it's called the Hidden US COVID-19 Pandemic. And they said that over more than 140,000 children have been orphaned as a result of COVID, either losing a primary or a secondary caregiver due to COVID-19 pandemic. More than 65 to 70% of those children are Black and brown. We've got another pandemic in the community. If we start to lose the grandmothers and the mothers and the fathers who've been taking care of these kids, the trauma of this thing alone, COVID is an ugly death. One of the things that I would certainly like us to leave by saying is that we have to think about more than ourselves. We've got to be here for these babies. And if that means that you need to go get vaccinated, go get vaccinated. We can't afford, with 12% of the US population, we can't afford to lose another brother or another sister. And certainly we can't afford to lose any of our children. On that note, gentlemen, I'd like you to each take 1 minute to give us one last word, or and then we can sort of ask if any. I see comments in the comment section, but they were all cheering you on.
Okay. Would you like me to go first, Deborah?
Yes,
since
Reverend,
we're in
you
that order, and maybe since my brothers took a little bit more time than me, I'll take more. Not really.
No.
You know, this is so needed, because in almost any category of health you want to look at, we are underserved and probably more impacted than any other community in this country. And so that's why we've been more affected by COVID-19, because it exacerbates existing conditions. And that's why the clinic that we didn't get a chance to really talk about was born out of the work with Choose Healthy Life, where, Pastor Jefferson said, we have people come in and out of our building every day that we're helping, and we didn't even know that their blood pressure was out of control, blood sugar out of control. So we have a little saying, I'm gonna close on this, that I came up with, and I tell all the folks with respect to hesitancy about vaccination, or without, regard to, whether or not they think they are engaged in washing the health, and that is death can wait. We're all gonna die, but we can postpone the inevitable by knowing our health status and doing the things to make certain we prevent an early death. I'm not going to cooperate. I'm not going to be engaged in the conspiracy. All these people talking about conspiracy. Well, the real conspiracy is your personal one, that you conspire with the circumstances of your life to not be tested, to not know your status, to not change your health habits. And that's what Choose Healthy Life is about. It's a topographical, transformative approach based in the Black church, where people trust us, that has to do more than collect money and build buildings, but make certain that the folks who inhabit those temples are well. And that's what I love about this project.
Amen.
Well said.
Reverend Jefferson.
Well said. I just want to add just something very briefly. Under Choose Healthy Life, our navigator has come up with a theme entitled Operation Fight Back. And it involves three things. One, engage. Secondly, inform. And thirdly, inspire, so that you can tell a family member, please go get vaccinated. Please save a life, because we are all family. And I would encourage everyone who's listening to this today just to remember those three things. Let's fight back. It does not have to get the best of us. In the days of Jesus, this particular vaccine would have been called a miracle. Mm-hmm. We now have a miracle. And as a result of that, we have something to fight back with. So if we inform, because there's a lot of worldly rhetoric out there that is diametrically opposed to the health and well-being of Black people. And we must make sure we tell people the facts. So we got to inform, we have to engage, and we have to inspire people when they leave the church or when they leave from hearing us, that they do something and not just hear something.
Amen. Reverend De Graff.
Health is not an issue just that's the medical issue. The reality in our communities is gun violence is up, domestic violence is up, divorces are up. And at this time, our people are turning their eyes, they're lifting their eyes to the hills. That would be the Black church. And so in this moment, they're going by old, reliable. And so we have to say to all those under the sound of my voice who are listening and or viewing, trust God. God, this is a God-inspired movement. We have to conform to contractual obligations to this one and that one. But we're getting this done, and we're going to conquer this as we have conquered every demon that has beset us in the past.
Amen.
Amen.
Amen. A lot of people have been asking, how do they support us? How do they get in touch with us? The website is choosehealthylife.org, www.choosehealthylife.org, all in one word. And we ask you to please, I am in seminary. That somebody's put it in the chat. Thank you so much. I am in seminary, but I'm not anywhere near or even trying to be the preacher that these gentlemen here are. But I do want to say to you this, that God is watching. God is watching everything that we're doing right now. He's watching to see whether or not you are going to take care of yourself. He's watching to see whether or not you take care of your family. He's watching all of those people who are telling people in our community, don't get the vaccine, don't do this. He's watching all the naysayers and the don't doers. He's watching, and he's watching you. And the moment you stand up and you walk, you'll be walking with God. And we want to tell you that that's the best place for you to be right now.
Deborah, I do have your license. I have your license ready for you, Deborah. I have your license ready for you, Deborah. I'll mail it to you in the mail.
She don't need a license. She already been ordained by the Holy Spirit.
Trial sermon is over.
Thank you, gentlemen. God bless you.
Thank you.
Thank
Our
you, Deborah.
time has ended. I love you all, and I love
Take care.
all of you
Thank you.
166 people in that audience. God bless you, and
Thank
we
you.
thank you.
Peace.
Bye-bye.